Good morning, and thank you for joining us for this edition of SBB Live Doc Talk. We have a very special guest on with us today from Physicians Regional Hospital, Dr. Yaritza Perez-Soto. How are you this morning?
I'm doing fantastic. Thank you. How are you?
Very good. Thank you. I'm so excited to have you on the show. I understand that you are a general surgeon. You practice in a lot of different capacities. Today's topic, we're going to kind of go into gallbladder, some of the symptoms, things that you shouldn't ignore and why you shouldn't ignore them. So just kind of giving everybody a preamble of what we're going to talk about today. But we also really like to get to know the physician behind the scenes. So tell me a little bit about yourself, where you're from, what brought you into medicine, and then, give me a little bit of a history of what brought you to Physicians Regional Hospital here in Collier County.
I am originally from Puerto Rico. I did all my school there, including medical school and residency. I don't come from a family of physicians. Nevertheless, my mother is a dietitian and worked in hospitals all her life. And my father is a biology teacher, retired. So science was always very important in the house. And I just really liked and was intrigued about the human body, and that made me want to become a doctor. Once in medical school, I realized quickly that I like to solve problems immediately and not just wait them out. So that's what made me become a surgeon. We are the kind of doctors that solve our problems with our hands and usually a knife. And the results are immediate, so that's why I like it.
Yeah, for sure. You definitely do solve your problems with your hands and your knife. That's for sure. Now let's jump into the gallbladder surgery and why it's so important not to ignore the symptoms, and maybe some of those symptoms that do exist for someone that's experiencing, and it would need a consult.
So gallbladder disease is very prevalent, especially in America. It is the most common operation that I perform and the general surgeons overall in the country perform, gallbladder surgery. The gallbladder is an organ that's located under the liver, and it is there to store bile. So when we eat something with fat, we can digest that and absorb that into our bloodstream. Oftentimes it gets diseased and it gets stones, or it can get infected, it can get inflamed. There's several risk factors. It's usually disease of younger women in their 40s and that maybe are overweight. It has to do with hormones and imbalances in the cholesterol in the blood. But it's very common to have patients that have a study for any other reason and they find gallstones. Usually, if you don't have a problem with that, we don't have to remove your gallbladder, but in specific populations, patients that are frail or they have diabetes or that are at higher risk of getting symptomatology, then we should remove the gallbladder when they are fine instead of waiting until it becomes an emergency.
Exactly. So you may have mentioned this, but as far as symptoms go, what are some of the key things that people need to look out for where they definitely need to see you? And then what, if there's no stones, then you're saying you might not actually have to remove it, but when would you actually have to do the removal before there's a problem? And kind of talk to us about, if you wait until it's an emergency, what the difference in the recovery time and some of those things might be.
So symptomatology of gallbladder disease usually includes abdominal pain in the right side of the abdomen on the upper part, close to the chest. This pain can also radiate and move and be felt on the back. Sometimes the pain is related to fatty meals, but other times it's random or wakes the patient up in the middle of the night after maybe a heavier meal, a heavier dinner. Some patients can have yellow eyes or yellow skin, urine the color of Coca-Cola or cola, and the stool, the feces, can become white or light in color or might float to the surface of the toilet. All those are symptoms of biliary disease, usually gallbladder disease. Patients also get nausea, vomiting, especially related to these meals. Patients start to be afraid to eat because they will experience pain after eating any meals. If you have any of those symptoms and you have gallstones, definitely that gallbladder should come out before it becomes an emergency. Emergency would be if the stones get dislodged from the gallbladder and get blocked in the bile ducts, or the gallbladder gets infected, the patient has fever, is throwing up, gets dehydrated. So when we do surgery electively, when you're fine, the best you're gonna be, most likely the outcome is gonna be good. If we wait until you're dehydrated, your electrolytes are off, you are feverish, or you have an infection, those are all risk factors on top of that to have an emergency surgery, and you can have complications from that. Complications can include having to open instead of doing a minimally invasive operation, infection of the incisions, leak of bile inside the abdomen, and damage to the biliary structures. So instead of going home same day after surgery, you are looking probably 2, 3, or more days in the hospital, getting antibiotics, fluids, and then the recovery is longer.
Yeah, it sounds like it's extremely important to be proactive and not ignore the signs that your body's giving you. So some of those symptoms are really good to hear because people may think that it's just a stomach ache, but it could be a lot more serious than that. But it sounds like if it's a reoccurring issue, this is it's a pretty clear sign as to what you would be experiencing for sure. So as far as recovery time for somebody that is proactive and gets it out, would you say their downtime is less than a week and they don't have a hospital stay? Is it outpatient? How does that work?
Usually the patients are home about a week, probably less. And they can resume almost all normal activities right after that week.
Okay.
Well, we don't recommend is heavy activity after any operation for 6 weeks, so you don't get a hernia, because that is the time it takes for the tissues to heal adequately.
Wow. Okay. Well, now I know you actually probably do regular surgeries on all kinds of different things, but I'm glad that we focused today on something that most people, it seems like they would be ignoring. That's why you wanted to cover this topic today, I'm sure.
That is correct.
All right. Well, thank you so much. If folks want to get a hold of you, which Physicians Regional Hospital would they contact?
So there is a main number for Physicians Regional, and that is where all the doctors get their calls, and they will be able to connect and to make an appointment as soon as possible.
Perfect. Well, thank you so much. I know your time is extremely valuable, and thank you as a healthcare hero. We appreciate you for all that you're doing. And if anybody has any questions, we'll make sure that the phone number for Physicians Regional Hospital is right in the chat. And I thank you so much, and I hope you have a great day.
Thank you.